The water's fine, homie, jump into the deep end. Sow it, you will reap it. We talking how to start it, how to grow it, how to keep it. Take a deep breath. You are now rocking with Founder Secrets.
Hello, everybody. Cristiana Banila is with us today. Welcome to Founder Secrets.
Hi, everyone. Thank you so much, Flavio and Taylor, for the invite. Happy to be here.
Thank you for coming. You're a true scientist, have an amazing background, and are doing a biotech company and skincare, which is like really, really interesting. So we're going to get to that. But first, I thought this would be a relevant icebreaker for us, which is, what is the best thing you do for your skin, Taylor? You will go first.
Well, before the pod, we were kind of joking, and I will say this. I think the ultimate compliment is for somebody to underguess one's age, which I try to pay that back to everyone else. So if somebody's like, how old do I look? I do the shoot, 24. I don't know. Like, I just think that's a nice thing to do. But then when people do it to me, I believe them. Like, I don't think they're being nice to me. I think that that's them being truthful. And I have been told I look younger than I am, which is nice.
You look very young. I would give you 25. I wouldn't give you anything above
25. Boom! See?
Yeah.
Well, I'm actually 24, so no, not. But what is my skincare routine? I think my wife rubs off on me here. I think a part of it for me is sleep. Like, sleep's really important to me, and I think we do a good job of protecting my sleep and getting a lot of sleep and trying to go to bed early. We get up very early here. And then the other thing that I'm probably going to get this wrong, but I read it on a Reddit thread and I've never stopped doing it, is it benzoyl peroxide, hydrogen peroxide? Is that sound accurate? No. And then a retinol thing. I don't know. I read it on Reddit, bought the products, have rebought it ever since, and then just do it at night. So that's my terrible routine.
Oh,
Good. That's
I feel like there's a lot of judgment in that. Nice. Oh, nice.
no, it's
Wow.
good. It's good. It's like I have mixed feelings about retinol products, but they're not bad. They're actually been shown to work quite well.
So they do work.
Yeah,
Yeah, I mean, to an extent. There's no problem too much.
to an extent. It works for a few years and then your skin falls off.
Then it kills you.
Then you get cancer. So other than that, it's fine. But look, so I also use, I guess tretinoin. Is tretinoin a retinol product? Yeah, so I was going to plug that too. But then also, actually, we need to have the founder of this company, Hyperskin. She works at a Soho Works, and it's a small company, and they do this serum, this vitamin C serum that supposedly takes care of dark spots, but it's like a cool brand. It's called Hyperskin. That reminds me, I'm going to make a note. She's going to come on the pod. So what about you, Cristiana?
Well, I'm not going to come with too many active ingredients, but one of the best things you can do for your skin actually is to use SPF 50, sun protection every single day, right? No matter what you're doing, no matter what retinoids, what vitamin C, what you're using on your skin, honestly, if you don't put the SPF on, like the whole damage from UV radiation is just going to keep on accumulating. So, go protect your skin.
Stay inside.
What if you just stay inside? Like, you just don't go into the sun?
Well, if you do stay inside, one of the things that I really like doing is exfoliation. So I do like to have a nice routine of exfoliating my skin once 2 to 3 days, and really keeps on and brings out the shine out of the skin.
Awesome. So let's dive into Mitra Bio. Maybe tell the story a little bit of how you came to found, because you have a background in science, and maybe you can cover that, because that was very interesting.
Sure, yes. So I'm a scientist by background. I studied biochemistry many years ago at Oxford. And then I had started when I was at Oxford, I had this passion about viruses that are causing cancer. I know this is a little bit of a side story, but I promise it will make sense. And actually, this passion led me into studying HPV throughout my PhD, and also developing a diagnostic tool based on epigenetic biomarkers to understand which women actually will progress into getting cervical cancer after having been infected with HPV. And that tool actually has been quite successful, and now it's been in trials with the NHS here in London. But the funny thing is, so the biomarkers I was using are epigenetics, DNA methylation, and these are very good for early cancer detection, as well as biological or epigenetic age prediction, as well as other phenotype predicting elements. So I was this lost student in London, and a friend of mine was part of this accelerator, and he invited me to come in and like give a talk, me with like a lot of technical background to these inspiring entrepreneurs. And I was there speaking to them all about vaginas and how to take care about HPV and always get protected, get the vaccine if they can. And then in this setup, I met my co-founder, and we clicked, and for like 6 months we started just ideating and just having fun. Really, it was really helpful, not necessarily helpful, but because the COVID pandemic was on at that time, I was just at home writing my PhD thesis and then ideating with my co-founder on the side. And what was initially a hobby became now a lifestyle after 4.5 years. So it's quite an interesting story that has developed. And what we're doing at Mitra Bio, we are a skin longevity platform powered by epigenetics. So essentially what we're doing, we have developed this non-invasive alternative to biopsies. It's an adhesive that is placed on the skin. It collects the skin cells from the surface, from the face, for instance. It's very non-invasive, very easy. And then we do sequencing on the samples, and we're looking at epigenetic biomarkers. Epigenetics are chemical modifications on top of the DNA that are affecting how genes are expressed down the line. Understanding the epigenetic landscape essentially gives you an understanding of how a product can influence the skin. What is the actual age of the skin, not necessarily chronological, but more biological in contact with the environment and so on. So there are multiple dimensions that epigenetics can inform from one's tissue. And then,
sorry, just real quick. So epigenetics is how your DNA is I guess transcribed or translated, and how it works in your body. Is that fair to say?
No, not really. So it's like you have the DNA. Epigenetics is more like the response to aging that you get, and it's more a regulating element for gene expression. It's kind of like a switch, if you want, like as you turn on and off the lights, right? This is how epigenetic works as well. So as you age, each tissue in your body gets an accumulation of epigenetic factors, like DNA methylation, for instance, and this kind of like inhibits normal gene expression, or
so like turns on and off some genes in your DNA.
So let's put it in context with collagen, right? Like as when we're young, we have like super nice plump skin, very nice elasticity, and so on. And then as we age, we get more DNA methylation accumulating on the DNA that influences how the collagen genes are actually expressed into the collagen protein. Therefore, we have less collagen protein. Therefore, we have more sagginess, and then all the effects associated with collagen.
If you didn't have this, then you're saying your body could continue to produce collagen for longer. Is that what you're saying?
So the beauty about epigenetics, not only that they're tissue specific, so if you want to go and study them, you have to go on the tissue. So if you're interested in skin epigenetics, you go on, collect samples from the skin and so on. The second most beautiful thing about this is that these can be reversible, right? Like we have certain elements of lifestyle that we go through. So for instance, you mentioned like good sleep, right? That's going to influence some patterns of DNA methylation or epigenetics on the genome. We have a certain type of diet. We exercise or we don't. We live in polluted or, less polluted, more rural areas. These are influencing how these epigenetic marks are being added on top of DNA and hence gene expression down the line. So if we're going and altering this, either by changing our environment or chemically, if we modulate it a little bit, with various compounds, we can get different patterns of expression down the line.
So is it different by cell? So each cell might have different things turned on and off?
More by tissue. So more by tissue rather than, because the skin itself, right, is a collection of similar cells. So they tend to have a similar behavior. But then the expression of genes in the skin is very different than the one in the liver, for instance. And this is, again, controlled by epigenetic.
By the way, does collagen, like I forgot to mention, I also take collagen. Does collagen work? Like does eating or drinking collagen make a difference on your skin, to your knowledge?
So
she's like, no.
Collagen. Well, wait for it. So eating collagen or collagen-rich products like bone broth and so on, right, is gonna get through the digestive system, and it is gonna be decomposed in peptides that can ultimately be used for more collagen production in the body. So in theory, yes, but now it really depends on your metabolic system and then the distribution of these amino acids throughout the body, right? Because you can target them for the skin, but I don't know, maybe they go into your cartilages, maybe they go in other parts of wherever you need those amino acids for protein building.
Interesting. Okay, so what you're saying is that there's certain ways you can study skin tissue, like say your face, and then you can read these epigenetic factors. Is that what you're saying? And
So
that's
what
what Mitra Bio.
Yeah, what we started off by doing with the company was to have a good way to actually measure these epigenetic markers and understand how they behave in aged skin, in young skin, in photo-damaged skin, and pigmented skin, and so on. And we have a classification of how these markers look in, let's say, a more youthful phenotype compared to an older one. And hopefully, through the work that we're doing and the intelligence that we're going to accumulate, be able to start targeting those, changing and reversing it. But maybe this is for the future.
Well, how would you reverse it? Is it like sleep and exercise? What you're saying, or you're saying there's some sort? You're thinking it might be like a compound, like a cream or something.
Yeah, it's possible.
All of
So
the above.
we can use topicals, we can use lasers, we can use super targeted, let's say, mRNA treatments. I've heard a couple of them and being developed for dermatological use cases. So what I can tell you is that there is a longevity revolution right now, and the skin is going to be the first organ to benefit from it.
Really?
Yeah.
So then it sounds like topical is better than eating it. So like what you described with collagen, you eat it and then it's everywhere in your body, so it might not affect your skin. But with like, so then why wouldn't everything just be very kind of targeted? You know what I mean? Like for example, hyaluronic acid. There's pills that you can eat, and like I guess it's all over your body. But then there's like serums that you can put specifically on an area. How would you compare those two, or is that even a good question?
It's a good one. So I mean, just maybe I'm shedding some light on it. Hyaluronic acid is a big molecule as well, right? So you really need to work with it. So you need to formulate it very well to be able to manage to penetrate the skin to actually have good benefits with it. So not all serums that contain hyaluronic acid actually are great for the skin. Bear that in mind. And then the sort of compounds that I'm speaking about, being able to modulate the epigenetic landscape to return the skin to its useful state, are more small molecules, active compounds, or combination of those, or as I mentioned earlier, lasers at specific wavelengths, like super tailored, that can change the behavior of the cell. So behavior of the cellular, the epidermis or the dermis, and then kind of like may fool them into start producing more goods, proteins, more elements to sustain a useful phenotype.
So, we look at a lot of websites of people who look at the websites everybody comes on. I gotta say, you have like a top 5 site. So, it's clean. It looks very professional, has good logos on here to build trust. And the first tab on the website says solutions, which when I see that, I think this is expensive. Like the word solutions on the website is code for expensive.
That's good feedback.
Which is good. Like, that's what we do, right? So I'm curious, how does the business model of the business work? Are you selling to, governments and health insurance companies? And like, what's the kind of model of the business?
Right. So right now, things are going to change in a little while, but right now we've been mostly working on a B2B model. So as I say, right, like us and then the skincare industry are on a mission to understand, first of all, these epigenetic patterns, how they look like in different states of the skin, different stages and so on, before, we go and we act and we change them targeted. So we're working with skincare companies, skincare and pharma companies on a B2B model. We deploy our products into their clinical trials that usually involve a formulated product that is applied on the skin. And the beauty of the work that we're doing is that it is non-invasive, so we can go in longer longitudinal studies following 6, even 12 months to understand how is that proposed intervention actually impacting the epigenetic of the skin. Do we actually see some form of change? Is the epigenetic age being affected? Are the markers for wrinkles or pigmentation being addressed? And then based on that alone, first of all, we gather information, we gather knowledge about how the skin behaves in contact with that specific intervention. And then we understand how that intervention actually, like the pathways by which that intervention might affect the skin, maybe some pathways that have not been researched before. So this is the form of work that we're working at the moment. But then we have had quite a lot of demand from clinics, right? So more of a B2B2C type of model. We had a lot of dermatologists, a lot of people in the wellness space that are just keen to have these readouts of the skin, not only the readouts, but also the predictive element of what we can offer, right? First of all, epigenetics is a dynamic marker. It's not just like, you just like have a readout right now and then, nothing will change. It will change over time. So if you want to keep on track, if you want to like be on top of, how various interventions are impacting your skin and so on, you have to come and like to do the test again. And then there are elements of prediction that can happen. So various products can be recommended on top of the readouts and so on. So this is what we're migrating into right now.
So maybe it sounds like there's larger customers you have. How did you get those large, whether it's pharma or these super large customers, especially being a startup? I guess did Oxford and kind of being incubated in that environment help, or how did you go about getting those first customers?
First customer is a very funny story. So when we started the company, my best friend was dating this person that was working at Avon. And then, at the meetup, I just mentioned, hey, I'm just thinking about starting this company. I think it's a revolution. I think we can definitely bring some value in the skincare industry. And then he reacted. He's like, hey, I can put you in contact with the head of innovation in Avon. And then he did that. And then for 1 year, we have navigated all the contacts that we could possibly find within this company to get to the key decision makers and discuss with them. They were super, super great in enacting our early adopters. They really understand what we were proposing. They really understand. They really wanted to understand the impact of their own products on the skin. We have our first case study actually published on our website, and it was a really, really nice success story on our end, being able to collaborate with them. But it took us quite a lot of time, and it took us. I guess this is kind of like the entrepreneurial drive, right? You just go and you find solutions everywhere.
The case study on the site, like it's very hard for startups to get case studies. You have one that looks very authoritative and it's detailed, and I'm not in your industry, so I don't even know what some of these words are. How are you able to get a case study? It seems so hard to be able to do.
Well, they really liked the work. We had like a good conversation with them. They wanted to showcase it. We found quite nice synergies with their products. We found patterns of DNA methyltransferase changes. So this is the protein that actually adds DNA methylation on top of the DNA that also changed alongside with the patterns that we observe, for instance, on collagen genes and so on. So it was quite a cool result.
How does you see? I see a lot of startups over the years that have apps that scan your skin and analyze, say, a mole or a spot, and they claim they can have some early cancer detection, or even using AI, or sometimes AI plus a doctor. I've seen so many of these startups starting like 15 years ago, all the way to this year. And my question is, how do you play in that? I guess, is there some potential for cancer detection in what you're doing?
Sure. Yeah, this is something that we have been exploring in the past. So we actually have had a successful clinical trial done with a hospital here in London. So we worked in partnership with Guy's Hospital to understand whether or not we can actually capture cancerous biomarkers from the tape the adhesive that we've been using. So the idea here was to test whether we can capture cancer versus a normal mole. And we recruited around 220 participants. We all taped them. We didn't know whether they actually were diagnosed with cancer, melanoma in this case at that time. So it was really, really encouraging to see that we can actually capture these biomarkers with quite a high accuracy. So to answer your question, yes, there is quite a lot of potential. And this is the sort of work that would come, let's say, complementing these computer vision tools that initially could start or could be used as general screening tools. So for instance, just used at home. And then when some patterns are being observed, Of course, right now they're being transferred to the GP, to the clinician, to have a look, and then the clinician, they don't really know how many moles actually are cancerous. Right now, the rate here is 1 in around 10 biopsies that are actually cancerous. So you had the 9 individuals that actually have to go through unnecessary procedures to actually understand whether they have melanoma or not. So this is where our tools could potentially come into the screening system, and I help reduce unnecessary biopsies, help reduce essentially costs associated with these biopsies and so on, and just streamline the processes a little bit more. But we do think it's quite a long way until something like this is going to be implemented, and it's a lot of work and clinical trial and data validation that needs to be put in place to get there. We hope to have this, let's say, possibility, to explore this possibility later on in our company development. So maybe like a Series B and so on. But right now we're just focusing on healthy skin.
So you view, I guess it sounds like on the one hand you're helping these clinical trials in a way as a contractor or consultant or company to helping them, and then there's also, it sounds like a potential for like B2B to C, and then I guess who are you competing against, or do you view yourself as this multi sub companies with under your umbrella, or how do you view this landscape you're in?
So specifically understanding or looking at skin epigenetic data, we're the only player that we know of that have cracked the story.
How's that possible?
I'm
Is
telling
it because you
you,
have like patent like process, or like how is it possible?
yeah,
Like what
because
if
we
like
have
Taylor steals it and like brings it to California? What's
go
stopping like
I'm
somebody
working
from
on it
doing
right now.
Yeah, please go try it. We have patents in place. We've actually worked with this adhesive for years to develop like a good DNA extraction process, and then develop the processing for sequencing, and then the algorithms behind the data processing, data analyzing. So please go try it. I really invite you to do this. So no, but there have been others trying to do this. So True Diagnostics, for instance, had an attempt at doing this with skin. They failed, and it doesn't really fit with their thesis with going well. They're mostly looking into systemic DNA methylation and so on. So they kind of like kindly stepped away. And then there was another company in the States, actually, Dermtech. They were not necessarily looking at DNA methylation, but they were using some form of adhesives to quantify whether lesions were melanoma or not. But then they had some struggles lately. I think going and partnering up with GPs in the States it's quite difficult, because you always have to understand who is paying. Is it the insurance company and so on? So it was a bit of a difficult play that they had. So they're not doing quite well. So here we are, still standing and growing, and we've identified even other streams of demands that we can address.
How is the entrepreneurial climate in London? Like, what is it like, getting support there, meeting other entrepreneurial friends, like peers, learning, mentors, fundraising? How would you kind of rate, or what's your experience been in London?
Sure. In terms of the network, it's definitely quite vibrant. There are quite a lot of very good companies, very good founders that we constantly just meet. So I'm in a building right now, like amazing founders everywhere and amazing teams everywhere. So it is just good to have that type of community in which to go, and you have a problem, they maybe can help you out. So there is that vibe. And in terms of fundraising, well, I guess this is where the US, I think it's exceeding. We're actually just finalizing the funding round, but with a US investor, because for the London ecosystem and then European ecosystem, it is actually quite tough. You have to show a lot of metrics, and they are not as risk prone, I presume, than other US investors that we've been speaking with. It's been still very good conversations that we've been having here, but I think the general appetite for risk is a little bit different in Europe and London compared to the US.
Wait, what's the building you're in? What's it called?
Yeah, you like it? It's a pretty cool building. It's called the Innovation Hub. It's part of Imperial College, and initially it has been built to poster spinouts out of Imperial College London, but then it grew so much that it started attracting other like external startups. So for instance, we're not part of Imperial College, but then we managed to get ourselves in this place, and we have labs over here. So we have like lab space at level 1, and then we have the offices at level 4, and it's filled with biotech startups. It's beautiful.
Imperial College sounds like so strong. Like
Yeah.
something.
There's like Arby's out front. Is it? Yeah.
You have personal security.
Yeah.
Queen comes by, looks at your product every now and then.
Makes a little smirk.
Sorry, the king.
Okay.
The king. My bad. So what I wanted to ask, kind of like it sounded you just did some funding, but I'm wondering. I always thought biotech requires tens of millions, of hundreds of millions of dollars of funding. Is that true for you, or how have you avoided that?
Or you muted.
Sorry, it's a good question. Usually, of course, you need a lot of funding to just kickstart a biotech company, and then you need even more funding when it comes to product development. What we managed to do, so we had an idea about the product and how it would look like, the level of detail that we want to get in terms of like skin health, how we want to put that information into action when it comes to essentially just stratifying the products that are out there on the market, measuring them. So that is the idea of the product that we actually received investment to build right now after 4 years of development. And in the 4 years that we've been active, what we've done, we started off as a service provider, right? So we had identified a need in the market. So it was the biopsies. The biopsies were invasive. People were not necessarily willing to do them in clinical trials. And then skincare companies really needed an alternative to actually go and measure their product on the face when the product is actually applied. So we started deploying our services within that little niche market, and we managed to be quite successful in it. So we've had like 1 million plus revenues so far just by doing that. And then this stream, it's still going to continue expanding. And then on top of that, we're starting building the product that, we set up by, we wanted to do. I mean, I'm not saying that we wanted to like really disrupt the skincare industry, but it's so much fog. It's so much information out there. You need something to just like guide you through everything. So this is what we're going to bring on the market.
Awesome. Well, as we wrap here, I'm wondering, I've read and Peter Thiel's talking about how there's going to be more hard science entrepreneur in the future. And I'm wondering too, the next, Cristiana, who's now getting her science kind of undergraduate degree, how would you advise that person to get into entrepreneurship and get started in biotech?
It's a good one. Well, first of all, it's not necessary. I think this is what I'm saying is not necessarily applicable to biotech, but like companies, like company building and common sense, identify a need, right? Like a need is better than a solution. To have a sense of the market, investigate the market, kind of like have a feel of how that market can be disrupted, or like whatever it needs, to just like move to the next level. And then go find super smart people to help you on the mission to solve that. But then with biotech, of course, you need a lot of research. So, it's a lot of work.
It's cool.
Yeah.
Very smart.
Yeah.
All right, great. Well, so the last question is a life hack that we all answer. And so I wanted to...
I got a good one.
Oh, yeah? All right. Go ahead.
All right. So social media, I have a love-hate relationship with social media. I've talked on this pod about how I do my screen limits. So I have 15-minute limits on social per day, which that has worked well. The challenge still is that the quality of the stuff I get on social is very haphazard. Like, in other words, I'll open up my Instagram and I follow a lot of comedians. So I have these funny, like, stand-up comedy bits coming at me, and I love those. I see updates from my friends, from Flavio and others. I love those. But then, the news will show up, and regardless of how you fall on any of the news spectrums, news is a total bummer. Like, in between, fun or interesting or maybe even sad stories about your friends and people you follow, you get these news stories that really have nothing to do with me, but they're almost all bummers, no matter where you are in any of this. So my hack is that I blocked all the news companies. So that's the hack, is that when there's all of them, when I see when one sneaks through on my feed, I click on the profile, I click block, not restrict, but block. And then that way, if you block it, then even if your friends like share an article from the BBC or whatever, it won't show. Like, it'll block it altogether from showing on your feed. And I will tell you, it has dramatically increased my fun factor of social media. So I did it on Instagram first, and then I rolled it out to Twitter. Those are really the only two I really use. So I highly recommend just blocking all the news, just block the organizations. So that's my life hack. Dramatically increases the like, and it like brings social media back to the way it was 10 years ago, 15 years ago.
Make social media great again.
Make social media
wonderful
again.
It was so good in the beginning.
Yeah, but it was just your friends and like funny memes, and now it's back to it. It's back to just friends and funny memes. So that's my hack. Block all the news.
I got a good one. Have you heard of Dorsia? DORSA.
Nope.
So Dorsia is a way of getting restaurant reservations at like the restaurants you can't get into in London, New York, LA, San Francisco, the Hamptons. So like Carbone in New York is an example. One is really hard to get. And so
I love this.
This app, I mean, you do have to like pay for it. Like a little, it costs a little bit of money, but it saves you, if you really want to go to like some amazing restaurant that you could never get into.
How much is it?
So to be fair, I haven't. So like my friends recommended it, so I'm about to use it. I haven't used it yet, but my friend used it like a lot, so I can vouch that it definitely works.
So
it's like it's $100 a year.
So Resi is trying to, Resi, the platform that apparently is only used in New York. Like out here, you don't see it. It's all open table. But, New York, you have like Resi and open table and all these, and they're all trying to pass a law to make this illegal. Because there was an article that I saw about it, and they're trying to, because I guess this is totally legal. Like this is okay,
California.
At least in the States.
California, man. There's like
they ruin everything. It just
because you're like the 6th largest country or whatever, it doesn't mean you can just enforce rules on everybody. All right, Cristiana, what's your hack?
Yeah, my recent life hack is having friends on Strava. It is amazing, like after a workout, when you receive those kudos from your friends because you've done your workout, really incentivizes you to, go out there and do it again and be better. And then, to receive those kudos. I've been doing this for, starting just with a friend that liked running initially. And then she started really liking, like my workouts. And, really, really makes me feel a bit more active and, it incentivizes me. It's a little dopamine hit that I get from that.
You have very supportive friends.
Yeah.
They're good. I like them too. I give them kudos.
The real hack is having good friends.
Yeah. You should create a friend membership service. Yeah. And then just lease out your friends to
give kudos to.
Give kudos to others. Yeah, exactly.
Well, Cristiana, thank you so much for joining us today. We learned so much. We appreciate your patience with us. And good luck with everything.
Likewise. Thank you, guys.
Thank you.
Thank you for rocking with the homies. Taylor, Trusty, and Flavio. Seize the day, own it. Until next time, hold it down, hold it down. Hey.